noches, and thank you everyone for joining us for this virtual town hall. Tonight, we'll be discussing the latest updates on COVID-19, including information on the Delta variant and how schools and workplaces can be as safe as possible as COVID-19 cases continue to rise across the county. I'm very happy to be joined by my colleagues at the Department of Public Health. Dr. Muntu Davis is with us tonight. He's Los Angeles County's health officer. Dr. Sharon Balter, who's the director of acute communicable disease control. Dr. Nava Jagane, a physician who's been working with schools throughout the pandemic, and Dr. Frank Alvarez, our regional health officer. We'll be answering questions submitted by LA County residents, and thank you all for sharing this important information with us this evening. To start, I want to tell you a little bit about how tonight will go. We'll start with some brief remarks from our panelists, and then spend the bulk of the time answering your questions. As a reminder, you can still send in questions on Twitter, Facebook, or YouTube. Y si quieres escuchar en español, por favor, llamas al 1-888-664-1453. Although case numbers continue to rise and reflect a lot of community transmission, with average daily case numbers now at about 3,000 new cases a day, we have seen a small slowing down in the increases of cases, which is really what we would hope for after implementing the universal masking mandate indoors. This does remind us all that masking remains an effective way to reduce transmission. When we compare our cases that were reported in the week ending August 1st with those reported for the week ending August 8th, LA County went from seeing just slightly under 20,000 cases to seeing just slightly under 21,000 cases. That was an increase of just about 7%. Meanwhile, in the remainder of the state, reported cases went from over 46,000 in the week ending August 1st to over 54,400 in the week ending August 8th. This was an increase of 20%. Although there could be reasons beyond masking that contributed to this threefold difference in the rate of increase between the county and the rest of the state, data from across the world and across our country have repeatedly shown us that masking is a valuable layer of protection against transmission of respiratory viruses. And so I just want to extend our thanks to everyone who's doing their part by masking up to help slow the spread. Obviously, the second and the most powerful tool that slows the spread is in fact getting vaccinated. So I also want to thank everybody who's taken time recently to come in and get vaccinated. I know for many of the folks that are coming in now to get their vaccines, there's a lot of worry and anxiety. And so I appreciate your courage in getting good information, making a decision that protects you, the people you love, and all of us who live here in LA County. As schools are reopening, I do want to take a moment before I turn it over to our panelists to talk about the Student and Parent Ambassador Program. One thing that we know helps with safety at schools, at workplaces, and in our community is for people to have a lot of good information of what steps you can take to keep each other safe. We have a Student and Parent Ambassador Program that does just that. We're recruiting for students to join the Student Ambassador Program now, and this program offers students to work with other students. They can learn skills, they get information about COVID, they get information about how to prevent transmission, and they develop leadership skills that allow them to work with their peers and spread the word about how we're all going to work together to stop the spread of this virus. The Student Ambassador Program is open to everyone, all students in all high schools across the county. And here you can see there's a QR code that can be scanned, or there's a link that you can, I don't actually see the link, We have a parent ambassador program as well. This is an online training that's available to all parents. You receive education and preparation for how you too can talk to your peers and other members in your community about COVID prevention. You get a certificate of completion, and again, you can sign up for this if you scan this QR code. By working together, teachers, students, parents, and school staff, we do have the strategies to open our schools, allow students to come back to be the best they can be, and to enjoy being in in-person classroom settings. For tonight's town hall, we've received hundreds of questions. And while we're not going to be able to get to all of them, we will do our best to answer as many as possible. And as a reminder, go ahead and continue to send us our questions in the chat on YouTube or Facebook, or send us a question on Twitter. We do hope that by sharing important our work together to protect our loved ones and end this pandemic. I do want to remind people that we have vaccination clinics all across the county. There are 800 permanent clinic sites and another 400 mobile teams that are out this week. So if you need more information, go to vaccinatelacounty.com and find a vaccination site near you. Now I'm going to turn it over to Dr. Davis, who will talk more about the ways transmission of COVID-19 can be prevented. Dr. Davis?
Thank you, Dr. Ferrer, and good evening to everyone who's joined us for this town hall. I'd like to talk a little more about masking and other actions we can take to prevent the transmission of COVID-19. As Dr. Ferrer mentioned, we're grateful to be seeing slower rates of increase in COVID-19 cases now that the requirement for indoor masking has been in effect for 3 weeks. This is a testament to the power of the simple action of masking, an action we can all take to reduce transmission. As a reminder, in Los Angeles County, everyone 2 years of age and older must wear a mask in all indoor public places, whether they've been vaccinated or not. If you're not fully vaccinated, your mask is one of the most powerful tools you have to protect yourself and other unvaccinated people. This is especially true when you're in an indoor or crowded outdoor space. If you are fully vaccinated, wearing a mask indoors gives you extra protection from getting infected, and it protects other unvaccinated people. Real-world data continues to show that people who are fully vaccinated are well protected from serious illness and death from COVID-19, including the Delta variant. But it appears that a small number of fully vaccinated people can get asymptomatic, or they don't have symptoms, or mild infections, and may be able to infect others, which Dr. Balter will talk about shortly. This is why, even if you are fully vaccinated, you're now required to wear a mask indoors. And for masks to work properly, they need to be completely over your nose and your mouth and fit snugly against the side of your face and around your nose. Your mask should be made of 2 or more layers of tightly woven, breathable material. Details about masks can be found on our reopening website at reopeninglacounty.com. While masking has been shown to be a very effective way to slow the spread, as Dr. Ferrer mentioned, vaccines are our most powerful tool in preventing serious illness and death from COVID-19. And we're hearing more and more that employers are requiring their workforce to be vaccinated. We're also seeing some jurisdictions and businesses require proof of vaccination in order to enter events and/or indoor spaces. These requirements are designed to protect the health of employees and patrons and to make workplaces safer. While indoor masking and quarantine and isolation of cases and close contacts are effective strategies for reducing transmission, the quickest way to slow the spread of this disease is to increase vaccination coverage, thereby decreasing the risk of infection in a larger proportion of people. Ultimately, the goal is to prevent as many serious illnesses and deaths as possible. If you still need to get vaccinated, we and our many vaccination partners can help. There are vaccination sites across our county, and you can find one near you at vaccinatelacounty.com. Again, that's vaccinatelacounty.com. And as always, there are additional steps you can take to protect yourself and your family, including avoiding crowded places. Being in crowds, especially indoors, puts you at higher risk. Washing your hands or using hand sanitizer often, especially after being in public spaces where surfaces are touched by many people. You should also avoid eating and touching your face with unwashed hands. and staying home when you're sick. If you have symptoms of COVID-19, talk to a doctor and get a test, even if you're fully vaccinated. You should stay home and away from others until you get the test result of your COVID-19 test or until your provider tells you that you don't have COVID-19. Thank you. And now I'll turn it over to Dr. Sharon Balter, who will give updates on the Delta variant and breakthrough cases.
Thank you. Good evening. The Delta variant continues to be a source of concern as it accounts for the overwhelming majority of new cases here in the county. Of all the COVID strains seen among the samples sequenced in the Los Angeles County area last week, the Delta variant comprised 96%. As we know, the Delta variant is more efficiently transmitted between people, likely due to its faster replication, higher viral load, and greater affinity for the lower respiratory tract cells compared to the earlier COVID strains. And while emerging data confirms that fully vaccinated people are well protected from severe infections with Delta variants, small numbers of fully vaccinated people have become infected and are able to infect others. Given that the Delta variant is more easily spread, common sense precautions are appropriate, and adding in extra layers of protection makes the most sense, as Dr. Davis mentioned. This includes masking for everyone indoors, distancing, and avoiding very crowded settings as much as possible. Unvaccinated people need to be particularly careful and should avoid high-risk activities and wear respirators such as KN95 or N95 masks if their work or activity requires that they are in close contact with others. And given the increased evidence that fully vaccinated people are getting infected, we continue to learn more each week on vaccine effectiveness and how to use this information to best keep ourselves and others safe and to get back to slowing transmission. To date, more than 5 million residents have been vaccinated. Of those 5 million people, only 15,628 have tested positive for COVID as of August 3rd, 2021. That is 0.31%. Of those who tested positive, 446 were hospitalized, or 0.009%, and even more rare were deaths, as only 41 people who were fully vaccinated have died. That represents 0.0008% of the more than 5 million people who've been vaccinated. What this tells us is the vaccine is extremely effective, even if you do get COVID. We highly, highly encourage anyone who is eligible to get vaccinated. Doing so will save your life and will help us slow the spread. Thank you. And now I'll turn it over to Dr. Nava Yagane to talk about vaccines.
Thanks so much, Dr. Balter. Hi, everyone. I'm happy to be here to discuss COVID-19 in schools, as well as COVID-19 vaccines here in Los Angeles County. As many of you know, we've spent most of our summer planning for our students to safely and successfully return to in-person education all along and across Los Angeles County. This fall will really be a joint effort and partnership between teachers, staff, parents, and students. Each school district has created a comprehensive strategy and recommendations to keep all school activities safe and to keep your child healthy. In preparation for school and as an ongoing measure, we're still doing our weekly telebriefings with the K-12 sectors to give them updates on protocols and developments within COVID-19 for our communities and our county, and we're there to answer any questions. We are reviewing our requirements and recommendations, and we've created these really strong partnerships between Department of Public Health, as well as Los Angeles County Office of Education and all the 80 school districts, as well as the private schools and the parochial schools and the charter schools over the past year. We want to again stress the importance of consistent masking, improving the ventilation, increasing vaccination opportunities, maintaining stable groups, doing as much physical distancing as possible, and improving access to COVID-19 testing. All these strategies can significantly reduce the transmission rates in schools. As Dr. Balter and Dr. Davis have mentioned, we know that the Delta variant is much more contagious than other variants. And to continue to keep schools safe, we're going to use a layered strategy. Protecting your child is a group effort, and as a parent, there are steps you and your child can take to protect yourself. First of all, of course, if you have a child who's vaccine eligible, they should get vaccinated. The vaccines that we have available right now are the most powerful tools we have to create a safe environment for your child and the people they come in contact. Now, please remember that our 12 to 17-year-olds can only get the Pfizer vaccine, and the Pfizer vaccine is a 2-dose series, and it's given 21 days apart. Once your child has received their second dose, they're fully vaccinated or fully protected 2 weeks after their second dose. That means that becoming fully vaccinated is a 5-week process, and there's no time to waste if your child is vaccine eligible. I encourage you all to visit vaccinatelacounty.com to find a vaccine location near you. You can also talk to your child's doctor about getting the vaccine, or you can possibly go to your school, because a lot of school districts are hosting vaccine events during the registration and during back to school nights. Second, of course, is masking. This has been discussed by others on the call. I would say that for children, getting your child a well-fitted, comfortable mask that they can wear all day is key. The mask should fit over their nose, their mouth, their chin, and they should be able to take it off and on themselves without any help. Third, checking in with your child and how they're feeling and making sure they're able to tell you if they're not feeling well. If they have any of the COVID-19 symptoms, we ask you to please keep them home and get them tested. I look forward to answering any of your questions, and I'm excited to turn it over to Dr. Frank Alvarez.
Well, thank you, Dr. Yudhakande, and good evening, everybody. And it's a pleasure for me to have this opportunity tonight to address your questions and concerns as well. And being now going extra innings, being involved with outbreak investigations for the past 18 plus months in LA County, it has been quite an experience with many work sites out there and many employers and employees. And first of all, I'd like to thank the many out there that have worked with us diligently to protect the workplace and employees. But as Dr. Ferrer mentioned, in the state of California, we have seen more than a 20% rise in cases recently, largely due to this Delta strain. And one of the major contributing factors to the rise in cases is also the obvious increase in summer gatherings and the recent return to work and school. With many people returning to workplace and other settings that involve a lot of face-to-face contact, LA County has continued to make tracking and controlling outbreaks a top priority. More than 5,500 outbreaks have been tracked in LA County since the beginning of the pandemic. And while that number fell dramatically over the last few months, below 20 at one point about a month ago, currently we have more than 200 ongoing outbreak investigations at the moment. A lot of people continue actually to ask us what constitutes a workplace worksite outbreak. And it's defined as 3 or more COVID-19 cases within a 14-day period at a workplace. When there is an outbreak, it is imperative that these cases are reported to our public health department within 24 hours so that an investigation can be done to determine if the outbreak is actually linked to the workplace. A site visit may take place by our outbreak investigation team within the following 24 hours to control further spread and to provide additional precautions, or even in some cases, a reconfiguration of work site that would help reduce potential ongoing transmission. COVID-19 cases and their worksite contacts involved within an outbreak must be isolated and quarantined immediately. And contacts should be tested whether vaccinated or not now before returning to work. Employers that don't have a COVID-19 prevention plan in place for outbreaks should also utilize our Department of Public Health resources at our website and develop one, quite honestly, as soon as possible. The immediate implementation of an exposure management plan after identifying even a single case of COVID-19 at any workplace can accelerate the ability to contain the spread of COVID-19 and prevent a single case from becoming an outbreak at the site. Several highly effective practices can be done to avoid outbreaks interrupting your business workflow and, most importantly, preventing endangering your employees' lives. The first is rapid reporting. please don't hesitate to report and don't wait to identify other cases. Reporting a single case can help us head off an outbreak before it even becomes one. Consultation with our team should begin as early as possible. Cases oftentimes multiply faster than one even realizes. However, you must report any outbreak by calling the following number. I think it's posted in the chat box, is 888-397-3993. The second highly effective practice, as you've heard, is masking. With the mask mandate in place, everyone indoors should be wearing one, and correctly. As a workplace, you should check in with your employees to make sure that they have new, comfortable, and properly fitting masks that are replaced as often as needed to be effective. And lastly, as everyone here has mentioned, is closing the vaccination gap. COVID-19 vaccine protection at the workplace is a great tool for yourself and your employees. And please continue to encourage your employees to get vaccinated and consider having a vaccine event at your workplace as well. And you can request and arrange our mobile vaccine teams by going to our vaccinatelacounty.com website. We've had great success recently with many worksite partners to increase their employees' vaccination knowledge and rates. So at this point, I want to thank you again for tuning in, for doing your part to get vaccinated and protect yourselves and your loved ones in our county. And now I'll turn it over to back to Dr. Ferrer.
Thanks so much, everybody, for your great comments and for providing excellent information to everybody who was able to get on with us tonight. And again, we want to extend our thanks and appreciation to all of you who have sent in questions. So I'm trying to group some of the questions. So if I don't ask exactly the question the way you wrote it, it's because we might have gotten a lot of questions on the same topic. But we're going to get started. And what we usually do, if we don't get to everyone's questions, we do try to put some answers up on our website in the next couple of days that get to most of the questions and the topics that you had concerns about. But I'm going to start with Dr. Davis. There are just a lot of really good questions here. I run a restaurant, but I'm curious, how would the vaccine mandate work? I want everyone to be safe, but I'm not sure how we would verify vaccination status. And she notes that she would like advice on what she's required to do with vaccine mandates for employees versus what she may have to do for her customers. So Davis, I know that's a complicated question.
No, but it's a very good question. And first off, at least in terms of vaccination requirements for people entering in the public spaces is not a requirement, at least, from the county. I do know that some local jurisdictions, cities are looking at it. And I'm hoping that those jurisdictions specify, in their requirement, what things you have to look for. But typically, and for employees, it's going to be really, if your employees are required to do that they show proof or documentation of being fully vaccinated and you keeping some acknowledgement that you have checked that and they, have shown you that in order to show any other regulatory agency that might want to check to make sure that you've done it and that your workers are fully vaccinated, or that they have provided you with a medical or religious belief exemption, if that's what would apply. For customers, this is something that we're been asked to explore, but it would be similar to what was done previously in other indoor settings when we were under the blueprint for a safer economy, where showing the vendor or operator of the event the vaccination status. So in a restaurant, customers would need to show their proof of vaccination, that they are fully vaccinated in order for them to be able to come into your restaurant in the inside area of your restaurant. That's what I would expect. But again, this is something being explored, and more details should come out if those requirements do come in place.
Yeah, I do want to note it's such a good question that, if you were looking to what is happening in other places, it's worth looking at some of the health officer orders that already have been posted. So we've posted some, the state has some, because I think one thing that's helpful is they give a very good definition of what is acceptable proof of vaccination status. And there's many ways you can show that you in fact are fully vaccinated. We don't have just one system, but it might be helpful to take a look at that now, because if there would be a vaccination requirement that's passed either by the county or by a city, I think almost everyone is using a similar definition of how to verify at a particular establishment. I also want to say there are many restaurants that are already doing this. So you don't really need to wait for the county or a city to make a determination that you want to have a safe work environment. You can go ahead and decide right now that you want all of your workers and your employees to in fact be fully vaccinated, and or you also want your customers to be fully vaccinated. And again, we're here to help. So give us a call. You know, there was a number that was posted earlier. Go to our website. You know, we applaud all of you that are thinking about during this, you know, really pretty dramatic set of increases in all of our metrics, cases, hospitalizations, and deaths. So if you're thinking you want to do something, we applaud your thinking about additional layers of protection. And vaccination, as we've said, is the most protective layer that you can have at a workplace. So going ahead and moving and not waiting for the city or the county to put out some order is completely both appropriate and allowed, and we're here to support that for you. And again, it's as an employer, you have the right to request proof of vaccination from your employees. I know some people get confused. Can they even ask for that? Yes, you can. And as a business, you can also set thresholds for who can come into your business. I mean, obviously, you know, you could, if you have a lawyer, you know, check in with how to word it. There are protected classes, but asking everybody who comes in to be fully vaccinated is in fact allowed. So, so again, I just give those reassurances to businesses. I'm going to move right over to Dr. Balter, because again, there's a ton of questions here. There's a lot of questions about the variants. How many other variants are there that we need to be worried about? And how do we know that Delta is still COVID or coronavirus and not a totally different virus? And should we be worrying that no matter what, we're just going to keep having more and more variants in the future? This is never going away. So that's, thank you to all the people who were asking those questions. And thank you, Dr. Balter, again, a really important question.
Excellent question. Yes, thank you, Dr. Ferrer. But why don't I start with how do we know this is not a totally different virus and what a variant is? When we test for COVID-19, once someone tests positive, you can sequence the isolate, and that means that you look for all of the different base pairs that are in the virus. And we know that this is the same virus because the overwhelming number of them are the same as the original virus. But viruses continually mutate all the time. And because COVID is spreading so quickly, it has a lot of opportunity to mutate. And certain base pairs will mutate, and we can identify those when we sequence them, and that's what makes up the variants. Now, sometimes it actually can take us a little while to decide that enough changes have occurred to call it a new variant. And new variants are evolving all the time. So it's an excellent question. Will they keep evolving? And the answer is yes, probably if we're probably not going to be able to get rid of COVID entirely. The only virus we've truly eradicated is smallpox. But we do hope that if enough people get vaccinated, COVID will eventually be relatively mild. That is not the case right now, however, because there are a lot of people who are still unvaccinated. And as we talked about earlier, unvaccinated people are more likely to become severely ill. Right now, there are about 4 variants that we're following, and then there are a few more that are being seen around the world that we're looking at. As we've said, 96% of the ones that we've tested in LA County are Delta. Now, not all variants are necessarily going to be worse. Sometimes you can have a mutation that spreads more easily, but actually causes milder illness. And many of the mutations that we've seen have been relatively similar. So it actually is very optimistic for being able to control COVID going forward, even if we can't totally eradicate it. And we'll do that primarily with vaccine, and then also with some of the other measures, at least for now, while there's so much COVID circulating in the world, to try to lower the number of people who have COVID.
Oh, thanks so much, Dr. Balter. That was an excellent answer, and it was a really important question. Dr. Yagane, a few questions, obviously, about vaccinations in children. Maybe we could start with, do we know when vaccines will be approved for children under 12?
Yes, thank you. This is a very common question. As a mother, I'm also very interested in when this vaccine will be available for the younger kids. So it's an area of intense interest. So I think that what we're looking at right now is that they're collecting data. So the pharmaceutical companies are enrolling or have enrolled 5 to 11-year-olds, and they're collecting data on their immune response. They're looking at their safety profiles, and they will, at least after vaccination, will continue to follow these children for several months. And once they have enough data, they'll be able to apply for the emergency use authorization. My understanding is that Pfizer hopes to have enough data to do so in the next month or in the next few weeks. And then the process of reviewing that data can take several weeks to months. And so once we know the vaccine is highly safe and highly effective, we can then hope that we will have an emergency use authorization. Meanwhile, we are taking every single precaution to keep our children safe. Like we've discussed over and over, vaccinating all the adults in our community, really cocooning those who can't be vaccinated yet, and then wearing masks, keeping them away from poorly ventilated and crowded spaces, and not taking any unnecessary risks.
Thanks so much. Dr. Alvarez, my job says we should wear masks while working, but I see coworkers taking them off, and the managers don't do anything. I want to report them, but I'm worried I'll get fired. Is there a number I could call, and can I stay anonymous?
Absolutely. That's an important concern you've got, and actually it probably continues to save a lot of lives and provide a lot of safety to workplaces. We've heard many times from employees anonymously, and they could call a number, and again, I believe that number is posted. It's 888-397-3993, and it's completely anonymous, where you could provide us information on the work site or any concern you may have in terms of any practice that you feel that might be unsafe or violating the health officer order. And again, it's a very important thing to do, obviously, in terms of your protection and protection of your coworkers. And then usually we respond quickly within a day or so. Our environmental health team will go out and do kind of a safety check, most times unannounced, and again provide education to the employer and see what we can do to improve the safety at any one of these workplaces. But again, it's keeping. I like to talk to folks about this is like the invisible fire, keeping a small brush fire, putting that out early and preventing, a very large forest fire of COVID at a work site. So again, thank you for that question.
Thank you so much, Dr. Alvarez. Dr. Davis, I'm going to try to rotate through. So I was talking to my cousin and asked her if she was vaccinated, and she said I can't ask her that because of HIPAA. Is that true? And what exactly is HIPAA?
That's an interesting response from one person to another. I mean, we ask each other as family and friends all kinds of questions, and you don't have to tell, but it's not because of HIPAA. HIPAA is actually titled the Health Insurance Portability and Accountability Act, HIPAA, HIPAA. It's actually a federal law that required some standards to protect sensitive patient information. And it really applies to individuals and organizations who are healthcare providers, health plans, or what we call health clearinghouses, and those that work with them, say like an insurance company, to process claims, for healthcare. So HIPAA doesn't apply necessarily to between you and your family member, who doesn't want to answer your question, but that's really what HIPAA is. It applies to healthcare providers, health plans, as well as health clearinghouses, and those that work with them using or disclosing sensitive information.
Thanks so much, Dr. Davis. Dr. Balter, this is also a common question, and we get it in many different ways, but I got the J&J vaccine, but I'm worried that it's less effective against the Delta variant. Should I go get the Pfizer too? And we also have questions that say, I've gotten 2 doses of Pfizer. Should I go get a dose of Moderna or go get a dose of J&J? Like mix and match, is that something that we should be thinking of doing right now?
This is an excellent question. And it is a question that many scientists in the United States are looking at now, and that both the FDA and the CDC are going to consider. Right now, we do have a lot of evidence, as I've talked about earlier. The current vaccine regimens are highly effective in preventing illness. So we are not recommending additional doses. This may change in the coming weeks to months, though. So we advise that everybody, sort of stay aware of the information that's coming out. But that currently, if you've received the current regimen, our data are supporting that you are protected.
Thank you so much. And I want to just, as a reminder, as a public health department, we rely on the FDA to actually do the studies that say what's safe to do in administering every kind of medicine, not just these vaccines. So we do need the FDA to write different instructions if that's what they decide, before we'd be able to promote that in the county. That's the safest thing to do, is to make sure they have their panels that are going to review the data, and then they'll make a decision, and then we can go ahead and implement it at the county level. But you don't really want like independent people sort of running around making decisions, I think we should do this, or I think we shouldn't. You want there to be a good review process, and we're lucky in this country that we do have that rigorous review. So I'm just, going to just put in a plug for people who are desperately thinking they need a booster to wait for the FDA to look at all of the studies. Much of what you're hearing comes from a manufacturing company, right? So, Pfizer is a big company, they're drug companies, and, you want another set of eyes on their data to do those reviews. So that's one of the reasons why we have the FDA looking at all the data that comes from a manufacturing company or a pharmaceutical company, along with the data that researchers are gathering. And that's a good protection we have. I know people are impatient, but it actually is good to have people reviewing all of the data that's coming from many different sources, and then deciding whether or not the instructions for how we use these vaccines ought to change. Sure, go ahead, jump in.
I just wanted to add, so people are aware, the group that is looking at this is first looking at whether or not boosters are needed for immunocompromised people, and they're continuing to look at studies and assess that data. So Dr. Balter is right, but just so people are aware, at the end of July, that group is looking at that group in particular to see whether or not they need to get boosters, but no decision just yet.
Thank you, Dr. Davis. Dr. Ugane, good questions here. Are colleges and universities required to have an online option? I don't really think I want my child to go back.
Yeah, that is a really good question. Well, institutes of higher education in Los Angeles County have really been our strongest partners in creating safe environments for students and staff. And I think they're, doing everything we're asking of them and sometimes going even beyond to make sure everyone stays safe. So there are different ways that they're mitigating risk in the classroom with large lectures. Some of them might be recorded. And so the core focus of that is to decrease crowding. And then there's some courses that you actually need to be there for, like lab component for a science class. And then that student would have to be on campus to be able to get all the necessary experience. So I do think it'll be different by every institution, and I do think that they're doing everything possible to make sure everyone is safe. Many of the universities right now have asked that everyone get vaccinated. They're requiring it. They are also doing a robust testing strategy. And because they're in Los Angeles County, they're abiding by masking indoors. So I would try to reach out to the university and find out a little bit more. But there are a lot of online courses I've noticed, and I'm sure that there might be a way to figure out a way to keep your child safe.
Thanks so much for that. I do want to note, I mean, we don't order the universities or colleges to offer a certain course or offer online. So it's not something that you would see coming out of the health department, but we do meet with them a lot, and they are. I mean, I don't know of any that aren't offering some opportunities for their students to continue with remote learning. So check around. Certainly, the Cal State campuses are all offering some online options, and I think many of the private schools are as well. Dr. Alvarez, this is an excellent question, and something I know we hear a lot about is, I work as a line worker. We can't really distance. What are some of the best ways for me to avoid COVID at work now that there are no distancing requirements and nobody is required to put up barriers?
Sorry, that is an excellent question, and it is obviously a very risky environment when you're in a line worker and you're tight with others. It has been, along with the skilled nursing facilities and a lot of the mortality there before we had vaccines, the first surges we had, very, very tragic to see how many workers, line workers, did get infected and how many died in many of these factories as well. And my heart goes out, condolences to all those that might have experienced, loss of a loved one. We've got, certainly a different game now. I mean, we've got vaccines to begin with to provide us immunity and protection. So I would say that, that is essential now. I mean, get the vaccine, get fully vaccinated, and hopefully those around you will be doing the same so you can get acquired vaccine immunity right off the bat. The other you heard, I mean, you'll keep hearing the same basic facts that, masking works. So all workplaces, every place now in LA County requiring to mask up. So everybody should be masking up in the work site. They should be wearing, again, the mask appropriately, open the nose and mouth, as you've heard, and they should be well fitted as well. And then again, if it is an outbreak, if it gets reported to us, like I mentioned, 3 or more cases, we'll be in there, and we'll be looking at the environment, the physical layout, and if needed, again, under the authority of Dr. Davis and the health officer here, we will be instituting, if we need to, barriers. We'll reconfigure a work site to include spacing so we can mitigate and stop the spread of the infection, risk in that particular work site. So that's not off the table. I mean, certainly if there's outbreaks, we will be in there and we will be mitigating that. The other thing to keep in mind, though, in many of these sites that we've seen, the other vulnerable location actually is, break rooms and lunch rooms. And we've seen, although that, there might even be physical barriers, folks tend to let their guard down when they go for a break, a snack, or a lunch, and they're tight again, and they don't wear masks. And we've seen many outbreaks just explode with that being the common factor. And then we've noticed even now when we go into sites that many employers actually have kept up some of the barrier protection for employees. So that hasn't all gone away. And my hat's off to those employers who continue to do those safety measures despite the new changes or the somewhat more relaxed changes with Cal OSHA. But really good question and really important concern.
Yeah, thanks so much. I do want to mention that Cal OSHA, that really has the responsibility for occupational safety at all of our work sites, also requires all employers to provide, upon request, a higher grade mask, respirator. It's like that's what people, you hear them call an N95, to any of the unvaccinated workers at their work site. So if you are unvaccinated, I mean, obviously, as Dr. Alvarez mentioned, your best protection is to get vaccinated. But if you are not yet vaccinated, please go ahead and request from your employer that N95 mask, that respirator. The employer has to make sure that it fits you well and has to provide you with enough respirators so that they don't get dirty or they're not able to be used safely. So again, there is that protection that's built in with the Cal OSHA requirements, and just about every business, particularly those that are doing line work in factories, manufacturing plants, you're going to be covered by Cal OSHA. So thanks so much for that. I'm going to go back, Dr. Davis, to you. This is sort of the question we get almost every day. Is there a transmission level where we would reconsider shutting down all large events or other high-risk settings like gyms, bars, restaurants? What would it take for us to go back down to having more restrictions, particularly around shutting down some establishments from opening?
Yes, it is a common question that we get. And as we look at this, we have to consider that at this point we have 3 very effective vaccines that are available, and we have a good percentage, although not enough, people vaccinated against COVID-19. And so it is providing a lot more protection than we had when we were in that instance where we didn't have the vaccines. And there was nothing to really do except for have people distance, require masks, and decrease the number of people inside places, as well as temporarily shut some businesses down. So we hope we don't get to that point. But even though we look at case rates, we're also looking at hospitalizations, and in particular, hospitalizations among fully vaccinated individuals. Now, if that is starting to get to high levels or moderate levels, and it appears that the vaccines aren't protective or good enough, then maybe something else needs to be done at that time. But it's a pretty dynamic situation, as we've seen over this last 18 plus months. But at this point, because the vaccines are in place, we are really paying attention to the serious outcomes that come from COVID-19. And hopefully those don't show up, especially among people who are fully vaccinated.
Oh, thanks so much. Dr. Balter, again, this is a question that we got asked multiple times tonight. Are there long-term health conditions that develop from getting COVID? What is long COVID? My mom isn't vaccinated and she thinks COVID is just a cold. I think you're still muted, Dr. Balter.
Sorry, I was having trouble getting off of mute. Another excellent question. Most people who get COVID will recover fully, but it is true there is a syndrome called long COVID that is not yet fully understood and is being studied by many people now. A very large range of symptoms have been described, and it may take some time before we fully understand what the long-term impacts are of COVID. In some people, They may not recover right away, but they do recover fully within a number of weeks or months. And then some people have continued to have persistent symptoms. Since COVID has only been around for about 18 months, we don't necessarily know how long they're likely to last, what their ultimate cause is, and how we can treat them. Many scientists are currently studying it, creating what they call registries of people to evaluate, doing tests to better understand it. But it is another reason to really encourage people to get vaccinated, because we don't fully understand who is likely to get long COVID and what the long-term implications are of that. So we're really, really encouraging vaccine for that reason as well.
Dr. Balter, I'm wondering, I'm just gonna, because we have a whole host of questions on this, if you could just, two things that I think are very related. We have questions about specific sort of long COVID illnesses, people asking about brain fog, neurological problems, problems with their lungs months later. And we also have questions on MIS-C.
Okay.
So if you could just touch upon both of those before we move on.
Yes, no problem. And I think that's what's somewhat complicated is there are so many different symptoms that are related to long COVID. Some of them may have to do with the fact, for example, if you have an underlying lung condition or you develop something that we often call ARDS when you get pneumonia, you may have a very long and persistent recovery. But it does appear that the virus also has other implications. Dr. Ferrer referred to brain fog, so extreme fatigue, difficulty concentrating. Some people, when they have their acute viral infection, will lose their sense of taste and smell. Almost everyone gets it back, but some people do not. And understanding who is at risk for which symptoms, which ones are, as I say, truly long COVID in that there's something specific to this virus and not just a longer term recovery for people who may have had underlying illness or had a specifically bad bout of pneumonia, is going to be important in figuring out how to address it. MIS-C is a specific constellation of symptoms that are seen in children. And what's interesting about it is not all of the children had any symptoms of COVID at all. Some of them were even unaware that they had COVID, but later on developed symptoms. Again, there can be heart symptoms, there can be fatigue, that they didn't have a good explanation for. And during the process of evaluating them, they realized that the children either were testing positive for COVID, because you can be persistently positive for a long time, or that they had antibodies to COVID, even though they weren't aware that they had an infection, although often someone in their household did. So it's somewhat different than long COVID in that a lot of the children really didn't have symptoms to begin with, because as we've described previously, children are less likely to have severe infections from COVID. But we do want to encourage things like mask wearing, in part to protect other people who could get COVID from them, but also because some children may be susceptible to MIS-C. And once again, we don't know, we can't predict which children that will be.
Oh, thanks so much. Dr. Yagane, this is, in some ways related to people who are concerned about long COVID in children. What's the implication? Seems like Delta has more transmission among children. So knowing that COVID cases are rising really fast, is there a plan to require schools to reduce in-person class size or go back to having just hybrid learning?
Yeah, thanks for that question. I also want to just again say that with long COVID, and I know there's so many reports coming out with long COVID, it does seem like a segment of those individuals do better once they're vaccinated. So it is this phenomena that people are describing when people have been struggling with long COVID, get the vaccine. And I've heard, 30 to 40%, actually their symptoms improve significantly. So if you are, an individual who's suffering from that, I would encourage you to consider getting vaccinated. So the question I think you had asked Dr. Freire really focused on how can we create safe schools, and would that be through reducing in-person class size? And I think that we are looking at the data very closely and sharing that information as quickly as we can to address these types of questions. So far, based on all the data we've been able to collect over the last 18 months, the most important interventions that have really decreased transmission in a school are to, again, vaccinate everyone who's eligible, including students, staff, parents, teachers, to continue universal masking indoors, and this is something that we've been doing for a long time, but also the Center for Disease Control and the American Academy for Pediatrics is also very supportive of. And then improving ventilation as much as possible. Outdoors is better than indoors, opening windows, upgrading filtration systems. And you're recommending other things like cohorting or keeping a stable grouping of children and trying to increase physical distance as much as possible. But we're really also are committed to making sure every student can attend school. We at this point are not restricting the number of children who are in a certain group. So I do feel like we are layering a lot of very important mitigation strategies on top of each other, and this layering is going to keep our schools safe during this time.
Thank you so much. And I also, want to say that Dr. Yagane, Dr. Gilchick, we have a huge team here that works with them and with all of the schools. So, we're not being facetious when we say when there are cases at schools, somebody gets notified at our public health department, and we work with every single school where there's an identified student or staff that tested positive to come up with a plan for how we're going to really prevent as much as possible additional transmission. So it's a huge partnership here. And I think if we all do our parts, if we're all super careful, if we make sure our children are following the rules at the school, and that we're being careful at home as well, so that we're bringing down community transmission, we're very hopeful that we can continue to keep our schools fully opened for everyone. I want to go on to Dr. Alvarez. Again, lots of confusion around the rules indoor at manufacturing settings. This is somebody who says, I see that the Cal OSHA rules just require people who are unvaccinated to wear masks, but I hear from others that we all have to wear masks. What applies at a manufacturing setting here in LA County?
So yeah, it's like you mentioned it on the last question as well, and I know it's confusing, and I feel your pain sometimes with the back and forth at basically at all levels. But yeah, over a month ago, Dr. Davis, Dr. Ferrer, I felt like really we're proactive with LA County in light of the Delta surge we're now in the midst of to move us towards that sort of universal indoor protection with masks. Again, it's very, very clear in the data that it is an effective barrier against both you transmitting to others unknowingly. Again, many of these are just asymptomatic spreading that we do, and it's really unfortunate, how crafty this virus has become. And so we have up the ante here in LA County, and I think it was a very effective move. It's kind of showing that our rates now are somewhat reducing in terms of the steepness of the rise. So everybody universally in our work sites, as I mentioned before, needs to be wearing a mask. And as Dr. Ferrer pointed out as well, with the Cal OSHA regulations, they do require that those folks that are unvaccinated, that they do offer N95s or more effective layered masks as well for those particular employees. So it can be a game changer, and we're starting to see some of that benefit.
Yeah, thanks for clarifying that, Dr. Alvarez. Dr. Davis, lots of questions on what what's open, what's closed, under what conditions. But let's take a common one. Will gyms remain open even though they don't enforce masks indoors, or are you going to shut them down?
Thanks for that question. And in general, we in the gym, everyone should be wearing a mask. We do, if we get complaints related to this, we will go out and inspect, and sometimes we do random inspections to see that businesses are complying with these indoor masking requirements. And if businesses aren't following that, they can be cited. And for repeat offenders, it may get stronger in terms of what can happen. But it's really important that we start with education to make sure that the business owner understands what the requirements are. We answer questions to try to help them ensure that there is compliance. And really important, that we maintain that partnership, and then they keep signage up in order to make sure that people who are coming in know what they need to do in order for the place to be as safe as possible. So at this point, again, we do go out and do our inspections, and we will give citations, but we start with education first.
Yeah, thanks, Dr. Davis. We have just a couple of these sort of questions about what are the rules. There's a question about, are churches exempt from the indoor mask mandate?
No, churches are not. They are public settings, and we just had a telebriefing with them as well to reiterate that. And many understand that and know and are complying with that, and ask for some clarification in general. But those are public settings, and they are required to have masking while indoors.
Thanks so much. Dr. Balter, again, lots of questions about variants. I think you've answered most of them, but there is one question that I think other people would love to get your wise counsel on. I'm hearing about a new variant called Lambda that's stronger than the vaccine is. By that, I mean that the vaccine won't protect us from Lambda. Is that true? And what is Lambda?
Well, Lambda, as I described earlier, is another variant that has been identified abroad. It actually doesn't yet appear to be spreading as fast as Delta did. In any given setting, there's a lot of different variants, and some of them spread more easily than others, which can allow a given variant to take over. So we don't yet know what its impact will be. But there's not evidence yet that the vaccine does not work for Lambda. We keep our eye on all of the variants. We track them very carefully in the county. We read about what's happening abroad, because often, as with Delta, the variants are seen in other countries first, so we can learn a tremendous amount there. But there's no evidence yet of a variant where the vaccine will have no impact on it at all. With Delta, we are seeing that people are definitely getting COVID, even though they have the vaccine, but they're not getting severe illness, which is often true with viruses and vaccines. So it's not completely surprising. But there's no evidence yet of a variant where the vaccine will have no impact. But everybody is watching this very, very carefully. And also the vaccine manufacturers are prepared, if that were to ever happen, even though we don't have evidence now that it is happening, to alter the vaccines to address this issue.
Yeah, thanks so much. And just, again, as reassurance, I mean, you see every week we present our data, and we see this vaccine is still doing exactly what the clinical trials told us they were going to do. They're preventing serious illness, hospitalizations, and deaths in just about everybody who's fully vaccinated. So with what we're seeing now, this isn't really a big concern. And because there's so many people tracking, both, we constantly are looking at specimens and trying to sequence them so we know exactly when we have other variants that are showing up in large numbers. I think people can feel pretty confident that this isn't going to be a surprise for us, that we're going to have plenty of time to notice if there's like waning protections from these vaccines, and if that happens, we'll use some of our other mitigation strategies, and put them back in place pretty quickly, and also rely heavily on the vaccine manufacturers who are already preparing, sort of ways for us to address variants with, subsequent doses of the vaccine. Dr. Yagane, these are also some really good questions that came in on, could you straighten out the confusion on teacher and student COVID testing? Every day I hear something different. It seems like today the governor announced that teachers and staff have to get tested if they're not vaccinated, but I didn't hear anything about students who are not vaccinated. Can you shed some light on testing at schools?
Yes, of course. Yes, it is a changing landscape, so I appreciate this question. Currently, we are recommending that students and staff receive testing on a cadence. And since we're seeing high levels of transmission, a lot of people are doing weekly testing, and we really are prioritizing those who are unvaccinated. This is, again, not a requirement, it is a recommendation. At the minimum, we do want school districts to describe a strategy to discuss how they're going to ensure access to testing for students and employees, especially those who are asymptomatic. So if you have symptoms of COVID, there should be a strategy to get you tested as quickly as possible. Also, if those who have exposure to COVID-19, so if you have someone in your school who's been diagnosed with COVID-19, to be able to get testing. And so that is something that all schools were asked to do, to create this strategy. On top of that, for people who are not having symptoms and not exposed, we are recommending that they also get regular testing. Again, prioritizing those who are unvaccinated, including students. And again, not a requirement, but it is a recommendation.
It might be important to note, if your child has an exposure at school to somebody who is positive, and our team is working with the school, in that situation, we may in fact require testing. So I want folks to understand, like, there are lots of different ways we are using testing. There's this routine screening testing. There's point of entry testing. Some school districts said before anybody can come back to school, they had to get tested and be negative. Some people are saying every week everyone has to get tested. Some places it's not quite that often. But then there's testing for people who either have symptoms and they need to find out if they're actually have COVID, or people who are their close contacts. And we may be telling people who are close contacts that they need to go ahead and get tested. So don't be surprised if someone says that, from a school, like, oh, your child needs to get tested. The good news is that, almost all the school districts and many of the private schools and parochial schools have already, as Dr. Jagane mentioned, they've already set up testing relationships with labs or companies or clinics that can help them do that testing. So, nobody should have to scramble to figure this out on their own. You're going to get a lot of support around testing if that's a requirement at a school, or it's something that you need to do if your child had an exposure. I'm going to go ahead and move on to Dr. Alvarez. Again, lots of questions also about, safety at large events. Dr. Alvarez, this is a question. Do we know if there have been any outbreaks from concerts or Dodgers games? I want to go, but I'm worried about being around so many people. How would you know if you had gotten exposed at a Dodgers game or at a concert? How would that work? So it's a complicated question. But go ahead, Dr.
Yeah, it's a complicated question. I might need to lean on a couple of you to fill in some of the gaps as well. But I'm a big Dodgers fan. Evidently, Dr. Ferrer is also a big Dodgers fan, it appears. And I can't wait to get out to a Dodgers game. I'm just waiting for my schedule to give me a break to get out there. But first of all, fortunately, the good news is that we haven't seen any recent outbreak from that's been identified in any of our major sporting stadiums or events. and usually, again, we get notified, from folks again that would report in these cases. We've got thousands, I think, of contact tracers that call and each individual case and find out their contacts and where they were at, and if they start putting this puzzle together and start seeing folks at a similar event at any one point in time, that raises a red flag to Dr. Balter's group. And then they notify us. We do further investigations, and so we haven't seen anything on our radar yet. Fortunately, at any of the events that we've had recently in LA County. It doesn't mean that it isn't a risky setting. I mean, there certainly, and Dr. Balter might be able to speak to this. I mean, there are outbreaks that have been reported, large ones, quite honestly, in other areas of the nation where you've seen a lot of folks get together and unfortunately let their guard down and congregate without mask and so on and so forth. So we have seen large outbreaks, and it is a setting where you could certainly get more transmission. And I think there's a lot of, at Dodger Stadium, and all the others, I believe, they now also, we require masks. They require masks when you're out of the seat, if you're on the concourse or any of the concession stands. I believe, all my teams that have worked with them, I mean, they have been very, very cooperative and very proactive in terms of information and the way they, provide guidance to everybody when they purchase their tickets online as well. I believe within the health officer order that came out the last update, July 30th, again, Dr. Davis might be able to speak to this, that they are now required at these large mega indoor and outdoor events to check, vaccination status. And also, if you're unvaccinated, obviously to require that you're wearing masks in these events. So again, there's a lot of safeguards. I think, again, I'm going to say it once again, is, the most important thing, again, is to build your own immunity through vaccination, to wear a mask, to try to distance yourself, even when you're at these events, the best you can. And again, generally, it's best to stay outdoors, than when it's, when it's indoors and you got poor ventilation, because obviously ventilation is a big key factor here as well for prevention. But I'll defer that question to some of the others as well. Maybe any of you that have recently visited one of these sporting events as well.
Why don't we start with Dr. Davis, because I just want some clarification on the health officer order. So Dr. Davis, why don't you start just sort of clarifying what's allowed, what's not allowed at large outdoor events and large indoor events, and what are those requirements?
Yeah. So on June 15th, when the state reopened, there was a requirement for indoor mega events or events with crowds greater than 5,000 to check vaccine status, full vaccination status, as well as or have a negative test in terms of those entering into those events. For outdoor events, at this point, it's been a recommended in terms of looking at vaccination status or a negative test. Masking is something that is required in terms of those indoor settings. Outdoors, it's not currently required, but again, everybody's looking at the data for large crowded events to see if there does appear to be a higher risk of transmission at this moment, and that may change, given what we're seeing in terms of spread, but that hasn't come about just yet. On the concourses of those places that are outdoors that really aren't outdoor concourses, meaning it may be a circle, it's got a roof, of course, it's got a floor, it may have one side that's a wall, that's not really considered an outdoor space, and so masking is required in those areas, which would be concession areas, or in restrooms and those locations inside of those facilities that are partially outdoors in nature. I'm trying to think if I've covered everything.
Yeah, sounds great. I don't know, Dr. Balter, or just maybe some more information on sort of these outbreak investigations. I think we all know it's a 14-day incubation period. It's super, super hard to pinpoint exactly when people get exposed. So I just want to say, sometimes we don't have good information. Most people who end up being positive, we do ask them about their exposure history, and they give us a list of about 10 places where they've been in the last 14 days where they might have gotten exposed. It's easiest if they know somebody who was positive. So if somebody says, oh yeah, I probably got this because my best friend is, I found out they were positive. That's a lot easier for us to figure out. But sometimes when, people say to you, yeah, I went to the Dodgers game, but I also went to a bar, and also there was a big party that I had with my family, then you start trying to figure out who else was at these locations and may have, ended up being positive. Do they know anybody who was positive? But you can imagine at the large, big events where you usually are going with just yourself or some close people, figuring out whether, you got exposed by some stranger sitting, in the seat next to you or at the long line you waited on at the concession stand is really hard for us. But I don't know, Dr. Balter, if you want to add to that as well.
Yeah, especially when we're in a period like we're in now, where we have what we would describe as community transmission. There's a lot of COVID in a lot of places. So unless you've spent your entire time home by yourself and only gone to one place, it becomes very, very hard to pinpoint exactly where people got it. We can look in general and say, in general, the people who got it said that they went to these places, but we can't be sure where people got it. But that said, I think most people understand common sense precautions. The vaccine really does protect you a lot. If you're in a very large, crowded event and you wear a mask and you're vaccinated and it's outdoors, it's probably a relatively safe situation, unless you're an extraordinarily vulnerable person, somebody who has maybe an organ transplant or something where you might just want to take more precautions right now because we're in a setting of community transmission when there's a lot of COVID in a lot of places.
Thank you so much. Yeah, we'll go back, circle around. I probably have time for just a few more questions, but Dr. Davis, again, these are tons of questions, same theme. I have plans to travel out of state to a family gathering in a few weeks. I'm fully vaccinated. I'm not sure if everyone else attending is. Should I take the risk and travel to this family gathering? And if I do go, how can I stay safe?
That's a great question, and it's come up a lot as we've gotten into the summertime. So I'd say a couple things. So one, if you're talking about traveling within the United States, nearly every state is experiencing high community transmission of COVID-19. And in each state, there may be different required precautions for the people who are there to take. The CDC, and we agree that if you are going to travel, you should be fully vaccinated in order to have that additional layer of protection. But I think the recommendation at the moment for me would be, if you can avoid that travel at this time, do that. And if the family can meet virtually, that would be good. It may not be the same, and I recognize that. But if you do travel, take every precaution, even if you are fully vaccinated, in terms of masking, keeping your distance, as well as frequent hand washing or using hand sanitizer, and try to keep the activities that you're going to do outdoors, especially if you don't know the vaccination status of those who are there. But even if you are and everyone is fully vaccinated, keeping those activities outdoors is definitely much safer. That would be the thought at the moment. Make sure you're fully vaccinated and take all the precautions if you are going to travel. It's often hard to do at a family gathering, but those are the things to keep everybody safe.
Thank you. Dr. Balter or Dr. Jagane, could you please speak about the safety of the COVID-19 vaccination for women who would like to become pregnant or for women who are pregnant?
In fact, the CDC just came out today and urged women who are pregnant or would like to become pregnant to get vaccinated. It has definitely been evaluated in pregnant women. There were many women during the course of the trials who became pregnant and have subsequently had their children. And it has been safe in pregnant women, but it's also important to emphasize that COVID is actually more serious in pregnant women. Pregnant women are more likely to end up hospitalized, in rare cases to even die from COVID, are more likely to have miscarriages. So we absolutely recommend the vaccine for women who want to become pregnant or are pregnant.
Yeah, thanks so much. I don't know, Nava, if you wanted to add anything.
No, I think Dr. Balter covered it well. We do, again, I want to say for individuals who want more information, we do have frequently asked questions on our vaccinatelacounty.com website. And there's a specific area just about questions regarding fertility. And there's some for teenagers, there's some for parents of teenagers, and then there's general frequently asked questions that are being updated regularly. And again, we do know that COVID-19 can be such a devastating disease for pregnant women, and we need to protect them, and the best way to protect them is through vaccination.
That sounds great. Maybe another question, just Dr. Jagane, while you're talking, and your mic is unmuted. Is there a way parents can track positive COVID cases by schools or by school district on your website?
So that's a very good question. I think that a lot of schools are making that available, and we are working on creating that report for individuals as well. Currently, we do have a public facing document that talks about the case rates per school district that is updated regularly on our vaccine toolkit. But I'm not sure if we actually have it for every single school district, but that's something that definitely is being considered. I don't know if Dr. Ferrer, you know of a resource.
Yeah, I mean, or Dr. Balter, I mean, I do know that if there are outbreaks at schools, that's reported publicly, and you can already go on our website. We do have a request for us to also post, and it probably happened weekly. I don't see any reason why we wouldn't be able to do this, post information on cases by staff and by students at school, by school districts. So I think you can look forward to seeing more publicly available reports in the very near future. But right now, just as reassurance, if there's an outbreak at a school, and remember, that's 3 or more cases at a school over a 14-day period where there's an indication that there was transmission at the school, that's what we call a link between those 3 cases. Those are already reported on our website, and you can feel free to sort of look at the history, and that is reported by school. So yeah, thanks a lot, and we're working with districts so that they give you good information. They're communicating. This is, one of the biggest concerns that parents are raising, which is how will they get information if there's a case at a school or if there's an outbreak at a school. And we've worked a lot with all the schools so that they have communication plans in place to notify the larger school community. And then obviously we work with them if we need to notify people that they've had an exposure in the school community. So I think people can ask at their school for what that plan actually is, because everybody has it and they have it in writing. But we will try to be able to create some easy way for you to look up that information, probably on a weekly basis, probably get updated weekly on our website. I do want to leave time for, our wonderful panelists, our brilliant panelists, to go ahead and just give a couple, each of you, if you don't mind taking a minute or two to just help close us out for the evening, that would be great. And I'll go ahead and I'll actually start with you, Dr. Jagane, just because your mic is open, so go right ahead.
Yeah, I of course want to thank everyone for coming to this town hall, and for Dr. Ferrer for asking these questions, and for everyone who has been working so hard on creating a safe environment for our children. I do feel like it is important for us all to advocate for the safety of our children and to take measures to keep the school environment as safe as possible. And that includes, again, the vaccinations, getting everyone who is vaccine eligible vaccinated, and then, doing everything we can to surround our children with those who are fully vaccinated, those who are wearing masks, and doing everything possible while we're waiting for our children to be able to be vaccine eligible as well. I'm very excited for the upcoming school year. Thanks.
Thank you. And Dr. Alvarez?
Yeah, again, I'd like to thank everybody, who's listening in, and everybody who's, really stepped up and hung in there. I mean, just to use the baseball analogy again, I mean, we're going extra innings now with a, really crafty pitcher here and so, everybody counts. Everybody on the bench needs to be in this game for public health protection. It's the collective action. And so you're going to be much better off with a batting percentage of 900, which our vaccines give us, than not having a bat at all. So again, I truly appreciate all you and the work you're doing at the work sites as well. Please go to our website. We've got excellent updated information for work sites on best practices and all the specificity with a lot of the health officer orders are there as well for you to review. I know there's so much there and it's really hard in the time we have to get through it all. But yeah, please give us a call if you've got any questions as well. We're there to help. So thank you all.
Thank you. Dr. Balter?
Yes, I'd also like to thank everyone, not only for being here, but for doing their part to help protect the entire community. It's something we have to come together and do together. So thanks to everyone for doing that.
Thank you. Dr. Davis?
Thank you, and thank you again to everyone and to all my colleagues who are panelists and Dr. Ferrer for hosting wonderfully as usual. I want to say that to remind people that we are still in an emergency. It is not a place that we in public health really want to be, and not where you all want to be. But we are still dedicated to providing you with accurate information, trying to make as many resources available as possible so that we can prevent more infections and prevent hospitalizations and deaths. And I really want everybody to focus in on the primary prevention strategies. That is getting vaccinated if you're eligible, as well as wearing your mask when you're supposed to, and keeping your distance if you're in situations that seem to be at higher risk, and make sure that you're washing your hands. Those things are tried and true in terms of helping to prevent this. But again, the vaccines are going to be our most powerful strategy in order to prevent hospitalizations and deaths and reduce the number of infections that we're seeing as well. We've had clear data that show the benefit of the vaccines. We have clear data that shows the safety of the vaccines. And at this point, it's up to each of us to make our choices for the collective good. So thank you.
Yeah, thank you so much, Dr. Davis. And I just want to add my thanks to everyone. I also want to, acknowledge, how grateful we all are for all of our community partners and all of our residents. And, everyone's exhausted and at this point, a little bit anxious. And I say that because for those people who got vaccinated, there's a little bit of anxiety because we have post-vaccination infections now. And many people were like, really? I still can get infected? This isn't a perfect vaccine? And what does that mean? And, how am I supposed to do this? I was really starting to feel like invincible. And then I think for the people who have not yet gotten vaccinated, and, I've had the privilege of being with some of our outreach teams and being able to talk to folks who aren't yet vaccinated. And they're scared also, and they're anxious also. They're anxious about the vaccines. They're anxious about getting infected. So this is what I think we do best in LA County is we take care of each other. We go with grace. We're respectful. We work to help make sure people have good information. We work together on that. We bring in people to services and support. But most importantly, we take care of each other. There's 1.3 million children in LA County that still are not eligible to get vaccinated. So every single person that does get vaccinated creates protection for those who cannot get vaccinated. And I think we can remind ourselves of, sort of the importance of surrounding our children, who we all love and are part of sort of this caring community, surrounding them with all of the tools that we can layer on so that they have a great school year. And we too, get the joy that comes from taking care of each other. So with that, we're going to thank you. We'll be in touch again in a few weeks, but you all know at this point probably know how to reach us. And we're glad that we're part of this wonderful community. So thank you very much.